Hi, I'm Joe Loftus. I'm the physio from Occupational Health. I'm here with my colleague Jane Aldroyd, who is a health and wellbeing practitioner, who's going to talk to us about why kind of now particularly health and wellbeing is so important. Jane?
Well, like Joe just said, health and wellbeing has always been taken seriously and it's a priority across the trust. However, during this pandemic, it's never been more important. Especially in relation to smoking, there's lots of evidence that clearly says that COVID-19 attacks the respiratory system. Those smokers and those who are exposed to the second-hand smoker are greater at risk. So think about your families at home that you probably possibly be working at home with. So stopping smoking is one of the best things you can do to improve your overall health and well-being and of those around you. So there are a number of ways to quit, but one of the more successful ways is by using the Stop Smoking service. So did you know that if you use your Stop Smoking service, you're 4 times more likely to quit than doing it alone, and it's completely free of charge in Leeds. So you can contact 1U Leeds either by email or telephone, and the details will be on StaffNet. We'll be able to put you in touch with an advisor who'll be able to then advise you on what the best nicotine replacement therapies are and what support's available. And thinking about a good diet and being physically active is also important.
Obviously, stopping smoking is really important. What more can you tell us about being physically active and having a good diet, Jane?
In relation to weight, COVID-19, there's now lots of growing evidence that being overweight is a significant risk factor in the successful recovery. So eating well and being physically active can improve your health and well-being and how you feel. And in short, really, everything about how you feel day to day. So in the long term, it can help reduce risks of long-term conditions such as heart disease, strokes, diabetes, and certain cancers, which now we're encouraging people, if you've got symptoms, to go to your GP, especially in this time. But also, whilst you're improving and you're going to kind of find out that them long-term conditions, we're going to improve your cardiovascular health and your aerobic capacity by doing activity, which in turn that improves that ability of the heart and lungs to get oxygen to the muscles to help that recovery. So that's why it's a combination of healthy eating and physical activity.
Okay, so have you got any sort of top tips for healthy eating and drinking then?
Yeah, again, think about the Eat Well plate that we'll all know through work about kind of having a good varied diet. So we want to aim to eat 5 portions of different variety of vegetables a day if we can, 2 to 3 portions of fruit every day. If you're thinking about bread and pasta and rice, try and get the brown, the whole grain versions because they're much better for us. Try and eat beans and pulses, fish and eggs and meat. If you're trying to have fish as well, try and at least have 1 portion which is oily fish. So that's things like salmon or sardines or mackerel, because not only are they good calorie-wise, they're also good for your health and your cardiovascular health. They can help reduce cholesterol. Keep an eye on your portion sizes. That'd be another top tip. I think we all probably know what we should be eating, but often eat too much. Then aim to drink about 6 to 8 mugs or glasses of fluid per day. And it's really important to keep hydrated. Water is one of the best things that you can do, free as well and cheap, but sugar-free drinks, fruit teas, herbal teas, coffee will count as well. So as long as you're having your instant coffees and you're not having lots and lots of really strong espressos. And talking about drinking, try and keep within the recommended daily limits for alcohol. It's easy to fall into that trap of having a drink to get through the times that we're in at the moment. But remember, alcohol is really high in sugar and then again calories. So if you're trying to control his weight, try and cut out that alcohol. Because did you know that it's really easy to put for that weight to creep on if just having 2 biscuits each day above what your normal energy that you need. So if you think about 2,000 calories a day for a man, probably about 1,500 to 2,000 for a woman, having 2 biscuits a day above that calories could cause about £5 of weight gain in 3 months. So maybe that lockdown period, so we could have easily put that £5 on. Thinking about the amount of calories that we consume, which is really easy some days, especially when we're all feeling a bit bored, that in each pound of fat, there's an extra 3,500 calories. So if you think about it like that, for each pound that you put on a body fat, you've consumed 3,500 calories more than we should have done. Back to the hydration levels, we really need the hydrating. We need to have water to be able to concentrate, and the body is made up of about 55 to 65% water. So back getting to water again and drinking. Alcohol is an appetite stimulant. So maybe if you are drinking as well and you're trying to watch the calories in your weight, that we may often eat more when we've been drinking alcohol.
So obviously a healthy and a balanced diet is really important, but what about sort of physical activity? What should we be doing?
If you look at NHS guidelines, it says that anybody between 19 and 64, so that'll cover a majority of us, I would imagine, in the trust, we should be aiming to do about 150 minutes of moderate intensity exercise per week, or 75 minutes of vigorous activity, or intensive activity. But sometimes it seems too big a hurdle to jump over all that activity, but it can be broken down to fit into your day. So if you think 30 minutes, lots of exercise over the week, or even split it down even more into 10 or 15 minute bursts. So we need to, that's really good because it's going to improve his aerobic capacity, but also we need to try and get some muscle strengthening sessions in per week. Hopefully 2 a week would be really good. You might think I've not got the kit at home to do it, I'm not going to the gym, how do I do it? You don't have to be lifting weights, you don't have to be doing anything that's strenuous. Muscle strengthening includes any kind of weight-bearing exercise, so things like yoga and Pilates are really good, also good for your mind as well. Or even walking's great, that's good weight-bearing. Okay. And remember, there's lots of instructor-led sessions that are free. NHS Choices have things online, there's lots on the YouTube challenge. You can always look out for your videos as well, Joe, on StaffNet.
All right. Any other top tips to try and get some exercise fitted in?
Just really try and get out at lunchtime if you can, especially if you're at work. If you can get out, try and have your break and get some fresh air. If you're working at home, try and get out and try and enjoy the weather, whatever the weather's like. Maybe it's not quite as bright today as it has been, but literally it can be a breath of fresh air for your mind and body getting outside. If possible, take the stairs, not the lift if you're in work. Or if you're at home, you can do a few reps up and down the stairs if you've got a staircase. And then yet again, look out, there's lots of things available now online. You've often got a DVD stuffed away that you've had, these Keep Fit DVDs that we never use. Now's the time to try and get them out and start thinking about doing things, or doing it virtually, doing a Zoom class with your friend, joining up and doing things like that. So if you'd like any more information, you can always give us a ring. We've got a health and wellbeing line set up at the moment, and you can contact us on 07717 335 800, or you can just email the normal Occupational Health email address. Thanks. Right. Bye.
Thank you very much, Jane.